Hello, everyone. So, today we are going to talk about the best way of assessing heart rate at birth in newborn infants. So, let's just start with this question. So, what do you guys think? What do you guys prefer to do? Which one is the best choice here? Four options are given. What do you guys think? Okay, so people practice different things. Most of the people would say that they will use the stethoscope to to assess the heart rate. The advantage of doing pulsation is that it's very quick, but the disadvantage is it's not accurate. If somebody is nervous or in acute scenario, it will be very difficult to rely on umbilical pulsation. A stethoscope is good, but sometimes it's very difficult to really assess because in acute scenario, when if it's a high risk infant, sometimes we see difficulty with the stethoscope. So pulse oximeter is a good way, but sometimes connection do take time, and same is the scenario with applying leads and getting the cardiac monitor. These two are the best if you guys can get it. Cardiac monitor, of course, is the best because it's give a real time heart rate with the rhythm. But again, every action has some drawback or some positive side to it. So anyway, so this is the introduction slide, and we are going to talk about more in later slides. So again, the same question. So what we are proposing here is why not we should do like a portable ultrasound probe as the assessment for the newborn heart rate. And so the idea came from our study, which we're going to show you in a minute, that this is a real time. The only thing would be that this will be expensive and how we are going to really put that into practice. These are the two things which we are going to talk about. And again, I'm leaving this discussion to you guys to decide. This is just an idea for our friends who has more resources and who have access to engineers can suggest this and then look further into it. To me, it looks like a very nice solution to assessing the heart rate, especially in high risk neonates, premature babies where resuscitation probably will be needed. In normal babies with when you're not expecting any problem, I don't think so we need ultrasound. We can just go with a stethoscope. That would be fine. But once you require to observe or monitor the heart rate, then I think ultrasound probe should be considered. Anyway, let's jump into the discussion again and see where we are now. So the analogy which I'm going to present here, you guys remember that this is the Neopuff. When it was introduced, we used to carry it on this wheels to the delivery room, and now this part, the pressure part, is all built in here. So now you don't have to carry this. The warmer, built-in warmer, has this facility to provide ventilation. So that is the analogy which we're going to use for the ultrasound. So like I said, the analogy is Neopuff. If we can wheel the Neopuff, why can't we wheel the ultrasound monitor initially before it get incorporated into the warmer? So we can create a little wheel like this. So in this analogy, this is something we can, your probe is here, your monitor is here, you can wheel it to all high risk deliveries, and then it's very easy to really assess the heart rate, which I'm going to show in the next slide. So this is what we are proposing, that if this comes here, why not this comes here? So this is one of our paper where we talk about that instead of doing inspection, palpation, percussion, and auscultation, we can use the ultrasound. So ultrasound is going to replace the stethoscope. So stethoscope is now taken over by the ultrasound probe. Especially those who work in emergency room, they know the value of ultrasound, portable ultrasound, that they can really do a lot of things with that instead of just using a stethoscope. And like I said, I'm not against using a stethoscope with resource limitation, and if especially newborn, if you're not expecting any problem, stethoscope will do the same job which an ultrasound probe will do. But in high risk deliveries, ultrasound provide more and acute and exact information right away, which I'm going to show you. So this is the study which we published. We looked at the feasibility of the handheld ultrasound in assessing the heart rate of the newborn. So basically, as you see, this is a cell phone. So this probe is attached to the cell phone, and then you can easily run. But what we are proposing, that instead of having everybody's cell phone separately, now we can go for a monitor, which many commercial companies are selling, and then have it on the wheel and take it for every delivery before we can put it on the warmer. The companies will look into and they will provide the warmer with the screen, which we're going to show you in later slides. So let's play the video and see how it works. So basically, let me just play it. So see the video. Now you see the, keep looking here. You see, just by putting just a little bit jelly there, you can really see the heart contraction. You count it for 6 seconds. If more than 6, you know, is 60 if you multiply by 10. So that's a very easy way of assessing the heart rate. So again, like I said, in resource, if resources permit, then what do you guys think? I will choose A. That was the idea about this small presentation. And let's see what the other suggestion in this presentation. So once we have this ultrasound available radially in the delivery room, and if it's a high-risk delivery, you know that we have 6-second rule. So if the contractions you counted are more than 10 in 6 seconds, you multiply by 10, so that is 100. So 100 beats per minute means that you don't have to do acute resuscitation. This baby can go directly to the mother, or do assessment. You don't have to start ventilation. But if you count the heart for 6 seconds contractions, and they are less than 10, it means that the heart rate is less than 100. So then you have to follow the NRP. For less than 100, you have to look if baby is apneic or not. You have to do the Mr. SOPA correction. So this is very important, a quick way of assessing the heart rate. The second part, if the contractions you counted are more than 6, it means that the heart rate is above 60. So you don't have to provide compression. This is a very important aspect in high-risk deliveries, because many times you get a baby out of a history that there's an abruption placenta or flat tracing, and they deliver the baby, hand it to you. Now people are trying to get the umbilical pulse. Somebody's trying to pull the pulse oximeter. Somebody's trying to listen to the heart. Here, the best way is you have this portable probe available. Put some jelly, put on the chest, and you can see exact contraction. If you count greater than 6, while other people are fixing the pulse ox and doing other stuff, you know that there is no need for compression. So this is a very acute way. You can avoid a lot of cardiac compression. And as all we know that neonates, ventilation is very important. But I have seen people jumping on compression in first minute of life if they don't see the heart rate coming up above 60, and sometimes it's an error in auscultation. The pulse oximeter is not picking up. So so this is the best way of doing it, using the ultrasound probe. So again, going back to this article, going back to this video, that what you basically do is just put the probe and count the heart rate. The thing is, this was done, as you guys realize, this was done on healthy newborn nursery babies, just to look at the feasibility of the portable ultrasound. And we showed that it's feasible. You can pull the article and read in detail the logistics, the methodology, and everything. So of course, as before bringing to practice, we do need a follow-up study to see if it works in delivery room. I think once we have this portable ultrasound on the trolley or on the wheel, we can do it. Logistically, the only problem would be to get the consent to them from the mother before the delivery to put this equipment on baby's chest. We were lucky here in this study because baby were stable in the newborn nursery. We got all the informed consents from the family, mostly the mothers, and then we were able to perform this study. But to perform a follow-up study, there logistically some elements have to be fulfilled before we can start practicing it in all delivery. So there is some potential for those who are watching it and they need an idea. This is a doable study. So basically you can just follow the same principle which is highlighted in this study. Do a follow-up study. That way, we can help our newborn babies not getting unnecessarily chest compressions if they are not needed. So the future, this is something like a probe. You can have a wired probe which could be attached through the UV port, or you can have a Wi-Fi or a Bluetooth device, and there are Bluetooth devices available. The probe connects directly to this monitor. Only thing, the company has to make a monitor, this one, compatible. They have to put a processor or other chip inside so that this this device, whichever is here, should be read and in this monitor. And this is doable. This is not something I'm talking about a rocket science. As long as engineers they know how to put it on the cell phone, they can put it on this monitor. So most of the cell phones have an app which you can download and use as an ultrasound screen. So on the same analogy, what we are proposing, if we have, instead of carrying this monitor, if we can put this screen here, or has a interface where this screen turns into ultrasound by pressing a button, or having a screen picture into picture, many things could be done, but I'll leave it to the engineers to sort it out. So again, the idea is that the US, the ultrasound probe attaches, or like I said, instead of attaching it, you can just use the Bluetooth, and then ultimately you can see in real time, you can see the heart rate and heart contractions. This is a start, and many things could be done later on. So like I said, this monitor goes here. So I hope you guys have enjoyed the video. Please do comment on this concept, and I hope people will look into making heart assessment as easy as possible, as accurate as possible, and as fast as possible. So I think the ultrasound holds some future here. So let's see how the engineers look into that, and those who have access to studying this in the delivery room should do a study. So this is all for you guys today. You guys have a wonderful day. Bye.